Good morning. Thank you all for joining us today. First, Dr. Don Yealy, UPMC's Chair of Emergency Medicine, will update us on what we've learned about COVID-19 in the past several months and how that can inform our actions going forward. Then we have Dr. David Nace, who's the Chief Medical Officer at UPMC Senior Communities and Director of Long-Term Care and Flu Programs at the University of Pittsburgh School of Medicine, here today to explain how UPMC is protecting our vulnerable elderly populations. After they give you their remarks, we will take your questions. Dr. Yealy.
Thank you very much, and thank you for attending again today. When our regions first saw COVID-19 cases nearly 2 months ago, much was unknown about the virus. Since then, we've learned a lot about the virus, and we're in a very different place today than we were at the beginning of our experience. We are much more aware, and we're prepared to continue to give both care and guidance. We started physical distancing and social isolation back in March. One of the reasons was to help flatten the curve, which means achieving a slower growth of cases to prevent our hospitals, and particularly our ICUs, from becoming overwhelmed. This worked in all the communities that UPMC served, and it worked because of you. We thank you. But flattening the curve did not mean that we would get rid of the virus or ultimately lessen the total number of people who developed COVID-19 infections or illnesses. It simply spreads the cases out over a longer period of time while we learn to provide care and have other interventions. While we await rapid breakthroughs that we've talked about with vaccines or immunities through antibodies, we expect that approximately the same number of people will get infected, whether we flatten the curve or not. It's just a matter of when. UPMC remains ready to give safe care no matter which curve exists, no matter what the local experience is. We have enough ventilators, protective equipment, beds, and we have plans to move quickly should we see increasing numbers of COVID-19 infected or ill patients, particularly those who need any hospitalization or inpatient care. We are ready for a smart reopening of society in all the communities that we serve. We know that any long-term shutdown has impacts not only on our personal lives, but on our economy. And we've already seen consequences to this for both physical and mental health. We also know now that there are certain segments of our population that are most vulnerable to the poor outcomes, even death from COVID-19 infection. Knowing who's the most vulnerable helps us take a more targeted approach to keeping people safe. Worldwide, here and in all the communities that UPMC serves throughout the Commonwealth, including central Pennsylvania and northwestern Pennsylvania, as well as those communities in New York and Maryland, we know that the elderly people are the most vulnerable, and particularly those who reside in assisted living facilities or nursing homes. For example, in Allegheny County, there have been a total of 111 deaths attributed to COVID-19 infection or illness. 86 of those came from people who were long-term care residents. Our outcomes are similar throughout the entire state of Pennsylvania, where the median age of death of somebody with a COVID-19 illness or infection is 84 years. Remember, the average life expectancy is 78.5 years in the U.S. The few younger patients who died all had significant pre-existing conditions in our experience. Very few children to date in our experience here in UPMC have been infected, and none died. Minorities in our communities have fared well. Not as well in some other areas, though. In some, we know that this is a disease that doesn't affect everyone the same, particularly the elderly, those that are sick, and those that are poorer. For example, across our entire system on Monday, we had 9 COVID-19 infected patients that were admitted. 7 of those came from non-UPMC nursing homes. 1 worked at a nursing home, and 1 was a 90-year-old. This is distressing, but it's also very informative. It tells us that we have an opportunity to do better. Nobody wants to think about their parents, their grandparents, or other respected elders dying before their time. This is why I'm pleased to share some good news. There have been no COVID-19 positive cases at any of the UPMC senior communities. The precautions we put in place early on and maintained throughout are working. Opportunity exists at other areas and across other nursing homes and facilities that we serve as a hospital system. We want to help them. In March, Dr. David Nace, the president of the Society for Post-Acute and Long-Term Care Medicine, told you of how he co-directed development of national guidelines on COVID-19 in those settings. Today, he will tell you how that guidance has served both UPMC and our patients.
Thank you, Dr. Yearley. UPMC provides secure and friendly surroundings to nearly 3,000 older adults in more than 30 UPMC senior community facilities throughout the region. Before there was a single case of COVID-19 in the regions that we serve, we put into place plans and precautions to protect our older adult residents. And we've adjusted and added to these precautions as we've learned more. These precautions and plans include carefully timed implementation of visitor limitations, coupled with creative ways for families to stay connected to our residents without entering our facilities, such as through video chats and drive-by parades, such as the one we're planning for this weekend with Mother's Day. We've had masking for staff, vendors, and essential visitors to all our facilities, and our residents also wear masks. Early adoption of enhanced screenings for everyone entering any of our facilities, whether it's a nursing facility, assisted living facility, personal care, or independent living facilities. And these screenings include not just a temperature assessment, but also symptom review and direct questioning about potential exposures to individuals with COVID-19. Enhanced screening of our residents, done several times a day, including temperature, oxygenation status, vital signs, as well as screening for a whole host of different symptoms. And we've used a lower, more sensitive threshold for temperature screenings. Our cutoff here is actually 99 degrees, not 99.5 or 100 or higher, which has been used in other locations, because we know that older adults have a lower temperature threshold, and they often don't have the same fever response as a younger adult might. And if any resident is found with a fever for any reason, they're put immediately into droplet and contact precautions until we're sure that they don't have COVID-19. Special attention is also placed to high-risk individuals, including, for example, those who are on dialysis. And then there's careful assessment of new residents before they come to our facilities as well as after arrival at our facilities. And through training and regular assessment of our staff and the proper use of personal protective equipment, such as use of gowns, gloves, and masks. As testing capabilities have increased, we've expanded our testing in a smart way. From the beginning, we have looked for not just the normal respiratory symptoms of COVID-19, but also the less common symptoms that may accompany this disease. And as this list grows, we learn and we adapt to it. And UPMC has also prioritized the running of tests on our residents and provided on-site specimen collection so we can ensure fast results without the need to travel off-site. It was important to us early on to keep not just our staff informed, but also our residents and their families. So we've held a number of virtual town halls where anyone can ask a question and give feedback to us. And these have been valuable to us in considering measures we might not have thought of, or in better communicating why we're putting in place certain precautions. Tragically, many long-term care residents have not had UPMC's success at preventing COVID-19 infections. These residents have been transferred to our hospitals for care, and we have seen firsthand how devastating this illness can actually be for them. We must learn from these deaths, and we are. We know that protecting the elderly is a critically important component of safely opening society. UPMC is sharing what we've learned so that other long-term care facilities in our regions and nationwide can replicate our success and prevent untimely deaths. And lastly, I think it's very important that I want to acknowledge the hard work that our staff has done to carry out each of these steps. Our staff are the heroes. It's one thing for us to put these plans and processes into place, but it's another thing to carry them out. Our staff are carrying these out, and they're critical to our success.
Thank you, Dr. Nace, not only you, but your staff for doing this really important work. We've discussed about what we've learned in this disease expedition and how we've been able to implement that, particularly in the most vulnerable, those that are elderly and frail. But you may ask, what about me? I need to get out of the house. I'm relatively healthy. I need to get back to work. The past several months have given us examples of what we can learn from. Early on, the world watched as the Diamond Princess cruise ship off the coast of Japan became the largest COVID-19 illness and infection cluster outside of China. Of the 3,711 passengers and crew on that ship, 712 tested positive for the infection, nearly half of whom had no symptoms. Sadly, 14 of those people died, nearly all over the age of 70. In contrast, think of the experience that you heard of with the USS Theodore Roosevelt. That ship was carrying nearly 5,000 sailors when COVID-19 was first detected. Approximately 1,000 of those sailors tested positive, but only 7 were hospitalized and 1 died. Any death is a tragedy. However, this helps put things into perspective. These are way different hospitalization and mortality rates between a cruise ship with elderly and vulnerable people and a ship with primarily healthy people. The lesson learned here is that closeness and density are important risk factors, but especially so for people who are vulnerable. For healthy people in all walks of life, school teachers to sailors, having the virus will likely yield either no symptoms or a symptom that feels like a cold or the flu. This contrast has real implications that we haven't fully embraced yet. COVID-19 is a disease that attacks many, but it ravages those with pre-existing conditions, especially the elderly. We can manage society in the presence of this pathogen, and we're going to have to manage society in the presence of this pathogen if we focus on existing conditions, particularly those related to the harm from the virus. Put another way, we're not going to be able to fix in the short term the ability to completely eradicate the virus. We're waiting on those developments. However, the problem we can fix is to focus on isolating and addressing the conditions of the most vulnerable part of the population, the people at risk. If we focus on the elderly, we will bring down the death rate. We can get that below 1% easily with focusing on those who will do poorly. The UPMC data are just as telling. To assure that we have a safe environment, we use personal protective equipment. We test all, even those that are asymptomatic, that are coming in for scheduled procedures. We use a preoperative assessment to make sure that we can test if the patient has active virus. To date, no one in nearly 1,000 patients tested coming in for a scheduled procedure in Western Pennsylvania has had evidence of the virus without symptoms. That's true across all of the system, where there's only 3 out of nearly 1,500 cases between Western Pennsylvania, New York, Maryland, and Central Pennsylvania that have tested positive. The frequency of silent carriage is very low. Our community prevalence is low, and we'll soon begin confirming that with antibody testing. It's a different test answering a different question. It also validates our decision to get back to providing the care that you need and is medically necessary. Last week, I told you that our surgeries at the peak of the COVID-19 experience were down approximately 70% at the lowest point. Half of that care has come back now, and we expect to return to normal levels by the end of the month. we can safely reopen not only our hospital care, but the region and society in all the areas that UPMC serves by protecting the most vulnerable, particularly the elderly, and doing things safely and smartly. We know how to do that. We flattened the curve long enough to make sure that our hospital system has plans ready and can implement them and can continue to manage COVID-19 infected and ill patients. We'll need to do this as long as we can because the disease is going to be with us for months to years. As long as we have the coronavirus, as long as we have the flu, the issue is protecting those who are most vulnerable, particularly the elderly, and not halting every social interaction or driving our economy into a depression. As others adopt these critically important measures that UPMC is using, I think that society will be able to move forward with less restrictive actions, common sense precautions, things like frequent hand washing, staying at home when you're sick, and wearing a mask and wearing it correctly so it covers all of your face, including your nose. Maintain some physical distance when you're out. We should be able to celebrate important occasions. This weekend we have an important one, Mother's Day. I won't be able to see my mom. She lives 300 miles away, but I'll miss her. If she is nearby, I want to be able to safely interact. We wish a happy Mother's Day to everywhere, especially my colleagues who love their children while providing world-class care to our patients. With a few exceptions, you can go out and share some of that special time if you're careful. You can do that this weekend, and you can do it moving forward. Thank you.
Thank you, Dr. Yealy, Dr. Nace. And now we'll take questions from the media, all of whom are joining us remotely online. To ask a question, you'll have to go to the participants icon at the bottom of the page and press the Raise Your Hand button. That will put you into the queue. I will then read your name, and your line will be open. Please make sure to unmute your own microphone to ask a question. We'll try to call on as many different media outlets as we can in the time we have allotted. So, first question, Paul Goff, Pittsburgh Business Times. Go ahead, Paul.
Yeah, hi. Can you talk to me a little bit about how businesses should move forward in the next couple weeks in terms of how they should, from a medical perspective, do their operations, whether they're manufacturing, business, retail, that sort of thing?
That's an excellent question. I think the basics are still going to be the things that serve not only individuals well, but any business. And the basics are, don't come to work when you're sick. Make sure your employees know that and understand that. Keep as much physical distance and limit congregation as much as possible. Make sure that you're doing the simple hygiene things, washing your hands frequently, keeping your area clean. Wearing a mask and wearing it appropriately. One of the things that I see most commonly when interacting outside of the hospital setting is masks that are worn improperly. It has to cover your nose and mouth. This is inadequate when your nose is sticking out. I think starting with basic, simple things like that will help everyone remain safe while we begin to reopen society. I don't think things like new medications or requiring testing of certain groups without any forethought is actually going to be the most important part of the strategy. We're doing that in a coordinated fashion to inform the community. I don't think for any individual business, unless there's something else going on, that that's really going to be necessary.
Thank you. The next question is an email question. Dr. Nace, what are the best infection control measures taking place in UPMC senior communities that other nursing homes and senior facilities should be doing?
So as Dr. Yealy had pointed out, what we have done within our facilities is really focused on the basics, going back to those things that make the most sense from an infection control standpoint. And that's implementing the screenings that we've done, being mindful that when we are looking for individuals with symptoms, that includes not just respiratory symptoms, but all these atypical symptoms that may be potentially present as well. It also means that we need to adjust for what an older adult might experience, the lower temperature threshold. We've also implemented the universal masking, where our employees are wearing masks. And we've aggressively gone after high-risk groups, individuals such as the dialysis patient, who is going out of the facility on a regular basis and may be exposed to other individuals. So by doing those basics of infection control and making sure that we communicate the importance of those to our employees, and making sure that they're properly trained to put on personal protective equipment and execute those processes, that's what I think is very important. What we have seen, and from our experience with other facilities beyond the UPMC, is that sometimes the difference is really coming down to how well we adhere to those basic principles.
Thank you, Doctor. Next question, Sarah Bowden, WESA. Sarah, go ahead, please.
Hi, Dr. Yealy. Question for you. So you said that, maybe I misunderstood. You said that we should be able to celebrate Mother's Day this weekend. Do you mean that like families should break the stay-at-home order and get together?
No, I don't think that I'm saying that you should break the stay at home, but I think having a visit with your mother in a small group with appropriate distancing and all the usual hygiene precautions makes a lot of sense. I don't think going against the current governmental recommendations make a lot of sense at all. But we can do this smartly, particularly if your mom is not frail, in a nursing home, or have underlying immunosuppression. We can do those kinds of things. There are measured steps that make a lot of sense and can keep everybody safe and help us deal with some of the social isolation that has real consequences.
Thank you, Doctor. Next question is another email question. I think this goes to Dr. Nace. Are UPMC skilled nursing facilities accepting recovering COVID-19 patients? What is the process?
Yes, so we are capable of accepting patients with COVID-19, but each referral for a person with COVID-19 is carefully reviewed and evaluated because we want to make sure that the appropriate precautions and safety have been put into place. So, for example, we are looking to make sure that if a person has had COVID-19, do we have an appropriate bed availability for that person? Do we have the appropriate protective equipment available to care for that person? Do we have the adequate staffing capabilities necessary to take care of that individual? And then we're also looking to see if that individual has tested negative for COVID-19 on 2 separate days. So a person that's had COVID, they're recovering, their symptoms have to improve, their fever has to have resolved, but we also want to make sure that when we test them that we're not actually finding active virus there. In those circumstances, that gives us a good indication that we could accept that person safely within our environment.
Thank you. Again, to the members of the media listening in, to ask a question, go to the bottom, go to your participants icon at the bottom of your page and press the raise your hand button. That will put you in the queue. I will read your name and we'll open your line. Please make sure to unmute your own microphone to ask the question. So we have a question from Angie Moreshi from WPXI TV. Angie, please go ahead.
Hello, can you hear me?
Sure can. Go ahead, Angie.
Okay, thank you so much. This is for Dr. Nace. Dr. Nace, it is very good news to hear that there are no positives at any of the UPMC senior facilities. I just was hoping to ask, we had done a story with some families who said it was difficult to get tests at some of the UPMC senior care facilities, even when some of their loved ones had symptoms. And so we're wondering, do you think that part of the reason there are no positive cases is that some of those folks were not tested? And even though they were isolated, they may have been positive, but they didn't actually have the test to confirm a COVID positive response.
Thank you, Angie, and it's a good question. What we have done is looked at this from the time period of early March through the time period of early May. And what we know is that several things have changed. Early on, we were focused really on the travel history, when a person had exposure to places because it had not spread yet through the rest of the country. What we also know is that the symptoms have changed over time as well. And so what we considered symptoms in the early periods of March are different than what we might consider today. And we also have a greater availability of testing than we did previously. So as each passing day, we are able to kind of expand our capabilities in terms of testing. And all those things have to be kind of considered in this. But I think even most importantly is that the discussion about some of those other individuals has to reflect the fact that there wasn't COVID-19 actively in our region in many of those cases. So when we look back, we have to understand that there has been some work done at the state level, also regionally, looking at nursing homes, looking at the community to see, is there evidence of COVID-19 here before we even realized it was here? And what we know is that individuals in nursing homes, we know that there was testing done by the Department of Health that had showed that there wasn't within long-term care facilities. So it's reflecting what is going on in the community. It's reflecting what is going on in terms of testing capability, and of course looking at, as the symptoms develop, what we might find. I don't believe that there is COVID-19 within our buildings that is unrecognized, given the fact that we've tested quite a number of individuals. And we also know that if COVID-19 is within a facility, if you have a single case of a symptomatic individual, you will soon have multiple individuals within that facility. So the chance that you had one person and it never spread to anyone else is really an unlikely possibility.
Thank you, Doctor. Next question, Megan Guza, Tribune Review. Megan, please go ahead.
Thanks for taking my question, Doctor. I just wanted to go back again and clarify with Dr. Yealy. You said that encouraging small Mother's Day gatherings is not suggesting people flout the stay-at-home order, but the stay-at-home order is pretty definitive in what it defines as essential travel. And as far as I can tell, family gatherings are not part of essential travel. So could you just kind of clarify again your stance on what people should or shouldn't be doing this weekend?
I think it's reasonable to be able to have a very small contact with your mother over the weekend. That does not mean an entire large family gathering, and I think that's what the governor's orders speak to. I think it can be done with thought, preparation, basic hygiene, and a little bit of planning. Again, we are not recommending large collections, even whole families, but an individual visiting directly either in person or using a video platform with their mother really is at no risk, and I think it's an important thing to do.
Thank you. Next question, Nicole Brambilla from Public Source. Nicole, go ahead. Okay, Nicole, make sure to unmute your microphone.
Okay, am I unmuted now?
Yes, you are. Go ahead, Nicole.
Perfect, thanks for taking my question. This is directed to Dr. Nace. I was hoping you could give a little bit more clarity about when in March you implemented at your long-term facilities some of these measures to ensure that the virus would not be coming in. And if you could also speak a little bit about what kind of supplies, even before the pandemic struck, were already in place at your long-term facilities.
Certainly, and that's an excellent question. What I can tell you is that our planning has been in place for quite a long time, even before March. As a matter of fact, I am part of a task force for the Society of Post-Acute and Long-Term Care Medicine, and we actually put into place the first set of national guidelines for nursing homes to follow and other long-term care facilities to be prepared for the possibility of COVID. And that's interesting to say because we talk about COVID all the time, but we were talking about the possibility of it actually showing up. And these actually predated the release of guidance from the Centers for Disease Control and Prevention. These were the first medical society guidelines that were available for specifically long-term care environments. So that was at the end of February, and they were actually posted on our website on February 28th. Throughout this whole time, we began looking at our processes. We have each year influenza, norovirus, all these other viruses And we have plans in place to address outbreaks. And what we quickly did was take a look at our preparedness for those conditions and use that to guide us what to do moving forward. As we looked at some of these processes, they were implemented at different time points. March 16th was the time point at which we really started visitor restriction across all our sites. But several days prior to that, we actually had started, based on some of what we were finding epidemiologically, in some of those circumstances that were or some of those facilities in the northern tiers. So we were watching very carefully as the first cases came into Pennsylvania, which were along the eastern coast board against New Jersey, southeastern Pennsylvania in the Philadelphia region. Within western Pennsylvania, we weren't seeing those cases, but we were also very careful to watch our left flank. And we were watching what happened over in the Ohio counties. And that was what prompted us when we started to see in Trumbull County some positive cases to start this whole process. So what we've done is really try to take a broad picture, take a look at what's happening locally, regionally, looking all around, putting those processes step by step into place over a series of several of days to weeks, depending on which process it is.
Thank you. Again, to ask a question, go to the participants icon on the bottom of your page and press the raise your hand button. I'll read your name, we'll open your line. Make sure you are unmuted when we call on your name to ask your question. We'll go to Bob Mayo, WTAE-TV. Bob, please go ahead.
Yes, for both doctors, this is sort of following up on Megan's question. Can you more clearly own or disown any differences between what you're saying and the state guidelines? It seems to me that you're both saying, oh, visits on Mother's Day, these other things are things that are perfectly safe, but to the extent that it conflicts with state guidelines, are you saying ignore the state guidelines or not? And if you're not saying ignore the state guidelines, how can you say go ahead and visit? Can you put a finer point on what you're saying and clarify that?
Yeah, I don't think that these are actually in conflict with the state guidelines. Visiting another adult who is not in a nursing home facility, is not immunocompromised or frail, and having contact at a distance for a short period of time without a congregation is actually not outside of any state guidelines. And so, in fact, I don't see the conflict there. Of course, in a nursing home setting, of course, with someone who's immunosuppressed or ill or has some other frailty, of course not in large groups or with direct extended physical contact. That's not what we're actually recommending. And I don't think that the Commonwealth says you're unable to have contact with any other human being throughout the entire period of this. They really tried to put general guidelines out there for other types of human interactions, not this type of personal. So I don't think it's actually in conflict for what's going on right now by guidelines and recommendations.
A very similar circumstance to look at is our funerals. And despite the COVID-19 circumstance, funerals have gone on, and those are being done in very small numbers, very close, closely monitored, and with the appropriate safety precautions, with necessary social distancing. So it's very similar for events like that. Within our long-term care facilities, it's important to remember we're not still lifting those visitor restrictions. So those visitor restrictions are still in place and will be in place in the coming weeks and months until we are absolutely clear that it's safe to move beyond those.
Thank you. Next question, Colleen Knudsen, WTAJ-TV in Johnstown. Colleen, go ahead.
Hi, good morning. Thank you so much for taking my question. Speaking as someone who has grandparents in their early 90s, late 80s, there's a lot of fear for them, and they're in independent living right now, so they're basically on their own. I know that you guys have your own guidelines in your facilities, but what are some things that people who aren't in facilities can be doing, whether they have people coming into their homes or if they do have to leave for medical reasons or anything like that?
So I think, when we talk about independent living facilities for older adults, we tend to think of of larger facilities, but individuals living in the community who are in advanced age, who have chronic comorbid conditions, heart disease or diabetes, or they might have had a stroke. Those individuals are at risk from COVID-19 as well. And so taking the appropriate safety precautions for individuals such as that are really important. When a person has to go out for necessary treatment, for essential treatment, essential medical care, or for going out for groceries, wearing a mask, making sure you bring some hand sanitizer with you and that you use that on a frequent basis, limiting the number of trips that you go outside of the home. And also, if you have home services coming in to support you, as you're staying in the community, trying to do the best to make sure they're using the appropriate protective equipment, a mask when they're coming in, and also to make sure that they're actually doing the same level of hand hygiene and other safety precautions that we would normally expect within an institutional setting. So regardless of whether the person at risk is at home or at a facility, those same things should still apply. Also limiting the number of visitors inside the home to the extent that is possible.
Thank you, Doctor. We have a follow-up question from Sarah Bowden at WESA. Sarah, go ahead. Sarah?
Sorry. Hi, this question's for Dr. Nace. So you already kind of spoke to this, but life at long-term care facilities, it's pretty austere. No visitors. I believe there aren't any trips to the community. I believe there aren't any communal meals. Maybe I'm wrong about that. Can you talk a little bit more about how life can get back to normal and like the sort of benchmarks that you need to see so people can start living a more normal existence in your facilities?
Yeah, thanks, Sarah. And that's a great question. And it's a question we struggle with on a regular basis. When we went to the visitor restriction policy, that was something that kept me up day and night because I tried to hold off on that decision as long as I could feel comfortable doing. In terms of making that decision, if we jump too early, we know that this is going to be here. I knew this was not going to be a 2-week out and done deal. When this went into place, this was going to last for months. There was no question about that. So it was timing, it was very careful, it was putting that into place. We are now into the place where those visitor restriction policies and the avoidance of physical proximity is there. So what we are trying to do is physical distance, but not social distance. So we have really tried hard. We have actually gone out and purchased iPads for all of our facilities. We've done everything to the extent possible to make sure that people have access and utilize those. A great story of a person who has cognitive impairment in one of our facilities who had never used an iPad before. She cannot really communicate well. She saw her son and her face lit up and she became so excited. And so by doing those type of things, by having the hallway bingo games, where you go down a hallway calling the number and everybody stays in their room, and you hear that one person at the end of the room yelling bingo. By doing things like window tic-tac-toe, where individuals can actually communicate through a barrier. And this weekend with Mother's Day, what we're trying to do is also trying to look at different scenarios. One of the things that has been looked at here is to try to get residents spatially separated in the parking lot, and then have family members drive by and say hello. Distance, 10 feet apart, and safety from the traffic flow, but creative ways to try to do this. We also have a parade that is planned for one of our facilities this Mother's Day that will involve the fire department and also the police department. And it will go through our campus, and people will be able to look out windows. We will be able to kind of hold signs, have balloons, and make it the best that we can make it given the circumstances that we have. So those are examples of some of the things that we're really trying to do. You're right, we don't have the communal dining right now because it's really important to try to avoid that. Looking forward, this is going to be in place for quite a long time. If you look at the presidential plan, phase 3 is where the lifting is for the restrictions relative to long-term care facilities and older adults who have those risk factors for more severe outcomes.
Okay, thank you. And that concludes the time we have allotted. Thank you all for attending. In about 45 minutes, we will email media attendees a link to download high-definition footage of the entire press conference, which we encourage you to use in your news reports. We plan to continue holding these regular updates for media as long as there is a need. In the meantime, reporters with questions are encouraged to contact our UPMC Media Relations Department at upmc.com/media, and please follow @UPMC News on Twitter for frequent updates. Thank you.